Hello, everyone, and thank you for joining us. This is Meredith Radell from Palladium. I am delighted to welcome you today to today's webinar, Building Resilient Primary Healthcare Systems, Propel Health's Approach to Global Health Security in Central America. We have a great broadcast for you today, and we'll begin with just a few announcements. Please be aware that this session is being recorded. We would love to hear from you, and we welcome your questions at any time. Please submit your questions via the Q&A feature on the top left side of the meeting window, and our moderator will read them aloud when we pause for questions. Finally, we ask that if you are not speaking, please mute yourself to keep the line quiet while others are talking. So we have a great agenda for you today, 7 parts, and a great lineup of presenters. We have Sunita Sharma, our project director on Propel Health, Allison Cheng, Division Chief of Emerging Threats Division at USAID, Kevin Kane, Global Health Security Specialist, Herminio Reyes, Country Director for Propel Health, Lizium Valladares, Country Team Lead for Propel Health, and finally, Reynaldo Flores, Country Director for Propel Health. I'll now turn it over to my colleague, Sunita Sharma, the Project Director for Propel Health.
Good morning, good afternoon, and good evening, wherever you are. I'm Sunita Sharma. I'm the Director of Propel Health. Thank you very much for joining the webinar to discuss global health security. PRH-led Propel Health project works with local actors to improve enabling environment for more equitable and sustainable health services, supplies, and delivery systems, especially in the areas of family planning and reproductive health and its integration with HIV, maternal child health, and primary health care. The project takes a policy, financing, governance, and advocacy approach and builds multi-sectoral coordination at all levels and strengthens resilient and sustainable primary healthcare systems that are flexible and responsive to health threats. Our partnerships are designed to strengthen conditions for frontline health workers and community stakeholders and to elevate multi-sectoral One Health coordination. We have 4 pillars: policy, financing, governance, and advocacy. The project focuses on integration and primary healthcare systems strengthening that underpins global health security work. So through policy activities, Propel Health strengthens local capacity to design, cost, implement, and monitor resilient and responsive policies, strategies, laws, and regulations. For example, we assisted governments to develop global health security agenda roadmaps with a One Health approach. With financing approaches, we support governments to advance public and private financing for primary healthcare services. This prioritizes the integration of family planning, reproductive health, MCH, HIV, TB, and malaria into benefit packages. We partner with the Ministries of Health and Finance to design financial management solutions that balance flexibility and control and better link budgets with outcomes. Countries need strengthened public financial management systems with built-in flexibility and subnational level fiscal autonomy to effectively respond to emergencies. With our governance work, we advance and institutionalize multi-sectoral coordination and cross-sectoral governance at national and subnational levels. For instance, we support multi-sectoral engagement, coordination, and alignment through joint global health security and One Health steering committees. Importantly, in our advocacy efforts, we focus on evidence. We strengthen information systems and foster data-informed decisions. For example, we co-conduct baseline assessments to improve health data systems for epidemiological surveillance, and real-time data collection, integration, and institutionalization. We assist governments adapt their data use strategies to address emerging and re-emerging and seasonal diseases that have epidemic and pandemic potential. This is all done in accordance with the international health regulations. Propel Health is engaged in more than 20 countries to strengthen resilient primary health care and ensure equitable access to essential family planning, reproductive health, MCH, HIV, TB, and malaria services. We are highly thankful to USAID, especially Population of Reproductive Health Office and country missions for the opportunity to engage in this important work. Now, I would like to invite Alison Chang. She has over 20 years of experience working in global health programs, including 18 years at USAID. She is currently the Division Chief of Emerging Threats Division, USAID Office of Infectious Diseases, and previously has worked extensively on PEPFAR. We are excited that she has joined this webinar. Alison, over to you.
Thank you, Sunita. And thank you for that great framing of this discussion today and for inviting me to join Propel Health's webinar on this important topic. Building resilient primary healthcare systems is a global priority for USAID. One key part of this effort for us is working in collaboration with a multi-sectoral range of actors to strengthen the systems that prevent, detect, and respond to infectious disease threats. We know that infectious disease threats anywhere can pose risks to everyone, especially given the realities of modern travel. This tenet is at the core of the U.S. government's Global Health Security Strategy, released earlier this year, which seeks to ensure a world where all people are protected from emerging infectious disease threats. USAID's Global Health Security Program seeks to prevent and mitigate the occurrence and severity of emerging infectious disease threats by strengthening country capacity and coordination efforts to prevent avoidable outbreaks and detect new threats early and respond rapidly when outbreaks do occur. USAID's global health security programming is targeted to build off countries' global health security self-assessments like the SPARS, voluntary external evaluations, and national action plans. There are many angles to approach this work. Priority areas of investment for us, which I think we'll hear about today, are capacity strengthening to prevent, detect, and respond rapidly, outbreak response informed by data, evidence, and lessons learned, multilateral coordination, and strengthen linkages across other U.S. agencies engaged in this work. USAID achieves these priorities through a wide variety of partners, from NGOs and academia to the private sector, multilateral organizations, research institutions, and of course, local partners. Propel Health has been one of our key partners on global health security and One Health in the Latin America, Caribbean, and also globally. Propel Health, along with Datafy and Epic and other projects in the region, are making an impact that could serve as a model for USAID programs worldwide. The local, regional, and national systems, including surveillance systems and governance structures we're putting in place, the multi-sectoral collaborations we help foster and strengthen, and the policies that we help inform, implement, and finance, all of these elements combined come together in a prevention to detection to response continuum. So I'm so glad we have many other USAID teams on the call today. I trust you will be glad you joined to learn about what we've accomplished in Guatemala, El Salvador, and Honduras. I'm looking forward to hearing about the discussion today. Thank you.
Thanks so much, Allison. We really appreciate you joining us today, and I greatly appreciate the framing that you offered. The challenge ahead of us is daunting, but together we can actually find the solutions and make them happen. Good morning, good afternoon, good evening, everyone. My name is Dr. Kevin Kane. I focus on global health security with Palladium. I want to start by taking a big step back and thinking about what really is GHS and why does it matter. The whole point of global health security is to detect and stop events from becoming epidemics or pandemics. And the benefit of that accrues to multiple levels. For example, the benefit occurs within the country where we're working because we limit the spread of disease to the area where it first starts instead of allowing it to spread and affect people in a broader range. The second thing is that there's direct benefit to neighboring countries if we succeed in preventing cross-border spread. And finally, there's benefit to the United States and the rest of the world when we stop threats at their origin. If we do all of this well, we end up saving lives and preventing massive economic harm. So what does this really mean, and what does it take to be successful? What it means, put simply, but implemented difficultly, is that we must be able to detect and address epidemic and pandemic threats anywhere in the world, and that we must do it immediately. We must be able to detect those threats, whether they occur in humans or animals. And I think a nice organizing framework for this is the framework that's referred to as 717. And what that means is that we must detect threats within 7 days of their emergence. We must notify, investigate, and begin a response within 1 day. And then we must mount an effective response within 7 days. If we truly do that everywhere, then we have a very good chance of stopping an epidemic before it starts. But if there's delays, like there were in West Africa in 2014 to 2016, when Ebola emerged in a forested area at the border of 3 neighboring countries, the result can be the cost of thousands of lives, the destabilization of entire health systems, and economic catastrophe for countries. So that's what's at stake. Now, I think we have to recognize that this is a huge challenge. What it requires is for us to be prepared everywhere. We have to have disease surveillance in both humans and animals. Why? Because if we don't, we could have the situation where there are multiple cases of rabies occurring within animals, and we don't know it on the human side until it costs a person their life. We have the ability to avoid that problem. Second, we need to have appropriate high-quality laboratory testing and specimen transport networks that allow those specimens from anywhere to reach the point where they can have the testing that they need. Third, we need near real-time, high-quality data from everywhere, not just sites with relatively better infrastructure, but actual equity where we have real-time data from everywhere so that we can actually have the information to understand what's going on. And finally, we need the human capacity to do all of those things. I'd like to highlight that I think a key foundation for all of this comes at the policy and governance level. Animal and human health must be brought together and thought about together. We have to have policies on priority diseases, and we have to have a structure for how data are actually discussed and reviewed so that we can have effective public health decision making. We have to have good policies and practices on antibiotic use that are actually implemented. If and when we don't, the result is that we have the emergence and spread of multi-drug resistant organisms. The third thing that we need are good policies on disease surveillance and network mapping so that we can have a real plan to detect the diseases that we've prioritized. And finally, we have to have those policies and practices for laboratory networking so that we can be confident that we have the capacity to do the testing that's needed in a high quality way, and that the specimens that need to be tested can reach the labs that have that capacity. And finally, I think, as I've mentioned, data is another key. All of these things are important, but unless we have good data systems that allow us to record the data, transmit the data to where it needs to go, integrate it together in ways that it needs to be, visualize it, and then actually have it reviewed for public health decision making, that will be the key to making sure that we can make good public health decisions. Today, we have a great opportunity to highlight examples from 3 countries in Central America that have practical global health security advances, including a focus on some of these foundational portions that I mentioned. So I'd like to go ahead and move on to those now. And we're going to start with Dr. Reynaldo Flores, who is the overall coordinator for Palladium Health in El Salvador. And with that, Dr. Flores, I'd like to turn the floor over to you.
Thank you very much, Kevin. Okay, let's review how PROPEL Health approach to global health security helped to build a resilient primary healthcare system in El Salvador. A couple of words on the context. Very important, the commitment from the government of El Salvador participation in global health security since 2022, in the middle of the pandemic outbreak. Second context element is the continuity of government strategy until 2030, according with the documents in the government and the Minister of Health. And also the Minister of Health wants to generate the what they call epidemiological shield as an example for the region. And with this, the idea is to enhance the epidemiologic surveillance to the community level, and that is very important for primary healthcare. Next one, please. Okay, following the three pillars of global health security in terms of preparedness, detection, and response, in the sphere of preparedness, we include financing, also advocacy, research, assessment. But I will emphasize in one very, very important item, which is the governance. Palladium generated the national coordinating mechanism as a main entity to coordinate the effort of One Health. And the success behind this national coordinating mechanism as a governance structure is the stakeholders. We have a group of stakeholders with a national group, which include health, environment, agriculture, defense, internal affairs, and also we have an international group of stakeholders, which includes FAO, includes PAHO, WHO, USAID, CDC, and a regional entity as SICA with OISA. So the idea is that that with this very strong national coordinating mechanism, that facilitates the activities, and also is a very important foundation, as Kevin said, for all the component of global health security in El Salvador. We have regular meetings with them, and all the stakeholder participate. So this is a very important point in preparedness. Next one, please. In terms of detection, we have three major activities. Coordination, we generated the route for data sharing and a unified information system with the three ministers. In the part of surveillance, we identified the needs of and the process of designing the epidemiological surveillance system for the following years. And that's how, with the Minister of Health, we decided to push on this idea of the epidemiological shield, which is basically an enhanced surveillance system. And the one important part is workforce development. This is a cross-cutting issue for all the components of global health security. But in El Salvador, we will emphasize work of the health promoters and in the country, and also the field workers of environment and agriculture. With the Palladium's detection work has resulted in the government requesting our support for dengue detection and response. And although we obviously we didn't have that in our original budget, but we made an effort to put aside some modest money for concentrate our effort in priority areas with high morbidity and mortality. Next one, please. Now, this slide is missing one very important part. This component of a normative document that we provide technical assistance for developed is important part, but we need to emphasize one thing. At the beginning of this year, El Salvador didn't have a public health emergency operations center. And we negotiated with the Minister of Health, with the Presidential House, the fact that we need to have a strategically placed the public health emergency operating center. And that is how the center was established and inaugurated in April within facilities of the emergency medical system, which is a priority for the government. So this part is very important. I mean, we help to establish, but the three things beside the establishment or within the establishment is important to mention. Number one, obviously, is the equipment that was equipped by USAID. This is very important. And the third component, not only the venue or the equipment, but is the fact, and this is very interesting, is that the Minister of Health has assigned full-time personnel for running the Public Health Emergency Operating Center. And this is very important because usually this type of center activates in times of emergency. But for El Salvador, this center has a permanent personnel. Okay, another component of global health security is a complementary project, which is antimicrobial resistance, is within EPIC. It's not PROPEL, but it's important to mention because it's within the global health security sphere. And we have many activities and in terms of antimicrobial resistance. Next one, please. Okay, I will say that very good summary of the result is the two lines in blue, which is year one of PROPEL Health, establishing the groundwork for a long-term partnership. This is extremely important. And I will emphasize in the epidemiologic surveillance component and the process of having the stakeholder in the national coordinating mechanism. Next one, please. So we come to the next steps. We does not need you to read it. I will summarize for you these next steps as follows. Based on the strong governance mechanism that we will continue supporting in the following years, Palladium Health, in coordination with USAID mission and the government, as usual, will develop technical cooperation in 5 major activities. Number one, epidemiologic surveillance system, which include a community-based epidemiologic surveillance and strengthening the sentinel centers that El Salvador has in 25 facilities in the country. Number two is the control of prioritized zoonotic diseases, 7 zoonotic diseases that have been prioritized with the help of CDC in the country. Third is very, very important is the investment in health promoters with a formal program for training. This training will last for 2 years, and it will give them a technician certificate. It's an important part for professionalization of health promoter in El Salvador. That is, health promoter are 3,500, which is a very important number. And at the community level, they are very important at the community level. Also, the fourth component is the continuous support to the public health emergency operating system, and the fifth is antimicrobial resistance. With that layout, I'm sure that El Salvador will and PROPEL will contribute to El Salvador in building a resilient primary healthcare system. And with that, I thank you for your attention, and I handle it to Herminia. Thank you very much.
Thank you, Dr. Flores. Good morning, everyone. It is a pleasure for me to present in the work that we have done in Guatemala in close coordination with multi-sector actors and other USAID partners. Next slide, please. To start, I want to share a bit about the Guatemala context. The demographic and epidemiological transition, the expansion of the drug corridor in Central America, the cross-border emerging infection disease threats, and increased interaction between human, animal, and environmental health necessitate an integrated and well-coordinated approach to prevent, detect, and respond to disease threats at both national and local levels. The need to strengthen the integrated primary health care system of Guatemala to be more resilient against emerging infection disease under the One Health approach had never been more critical. In 2023, Guatemala became the only country in the region to complete the voluntary external evaluation. This evaluation provides stakeholders with data on country strength areas for and the areas for to improvement to be compliant with the international health regulation. You can see in the right side of the screen the voluntary external evaluation findings with the technical areas we are supporting highlighted in yellow, which we will be sharing with you today. PROPEL Health is also ensuring that our support is alignment with the United States government 2024 Global Health Security Strategy and the findings of the recent One Health landscape analysis conducted by USAID Guatemala. Next slide, please. PROPEL had been working in the area of global health security this year. Focusing on the areas you see here, we have worked on workforce development to include the global health security topic in curricula of laboratory technician and nurses assistant. And we are working also to include it in the curricula of rural health technician, environmental sanitation inspector, and technical nurse. Also, we are working to create the enabling environment to improve financing and resource optimization for global health security, conducting analysis of potential global health security gaps at the subnational levels and the entry point. Our technical assistance of this area is complemented by DataSci by our sister project Data5, who is 2024 was able to hold working meetings with the Ministry of Agriculture, the Ministry of Health, the Wildlife Conservation Society Organization, USAID, and the United Nations for Food Agriculture to develop a scope of work for One Health information system strengthening. Next slide, please. I would like to share what parts of the voluntary external evaluation findings PROPEL is prioritizing in the coming year. So mass communication as continuation of progress made in 2024. The first area for important improvement found by the voluntary external evaluation is capacity area 1, policy, legal, and regulatory instrument. In the new fiscal year, we will work with the Ministry of Health to develop national and subnational plans that include the introduction One Health approach governance. These plans will create the roadmap for comprehensive sectoral and intersectoral preparedness and response in environment security challenges. We are also collaborating with National Strategic Intelligence Secretariat to develop and apply models for anticipate, recognizing, and addressing health and environmental security events. It is also important to note that this year, our sister project, Data5, supported the development of an interinstitutional technical working group for strengthening and use global health security information system at the central level, which will be important in detection. For capacity area 3 financing, this coming year, Propel Health will support the Ministry of Health to develop a methodology for investment decision aimed at optimizing the distribution and functional level of the establishment in the health services network, including laboratories. Also, we will work with the Ministry of Health on municipal health district management model for the department for one department. So it is streamlined with the annual operational plan and the budget. Also, at the central level, Propel Health will work with the Ministry of Health for implementing the supply management system of Ministry of Health supported by USAID. This system includes mechanisms and processes of intelligence in purchases for planning, execution of purchases, and optimization of resources to allow for effective and efficient responses to health emergencies, among other objectives. These activities will have an emphasis on global health security and disease prevention and involve a high level of engagement with technical, administrative, and health personnel who carry out surveillance activities. Next slide, please. Our sister project, DataFi, is particularly focused on supporting Guatemala's surveillance capabilities, collaborating with the Ministry of Agriculture, the Ministry of Health, the Wildlife Conservation Society, USA, and United Nations Organization for Food Agriculture for the development of a global health security dashboard that prioritizes indicators and is institutionalized for use at Health, Environment, and Agriculture Ministry. This dashboard will visualize human, environmental, and animal health data to be reviewed regularly by these ministries for outbreak monitoring. Alternatively, Propel Health has capabilities on human resources for health, where we are collaborating with the Ministry of Health training schools to introduce the topics of global health securities and health safety into the curricula of initial and ongoing training processes. Propel will also continue to support the Ministry of Health to develop the human resources training policies to regulate and standardize the training human resource in health at the national level. In addition, Propel will support the Ministry of Health to establish and maintain an up-to-date register of certified workers in global health security. Next slide, please. For the health emergency management area, Propel Health is currently examining the current situation and opportunities for improvement of municipal capacity for health. These include health indicators such as for WASH, but also will include One Health indicators. In addition, we will promote coordination between the Ministry of Health and Guatemala Institute of Social Security so that the latter is integrated in One Health approach. At the national level, DataFi is developing a detailed and new organizational structure for Technology Information Directorate that will be included in the Ministry of Health internal organization regulation. They are also developing a proposal for the strengthening of information system under One Health approach, with the objective of aligned effort and investment in the digital ecosystem used by One Health actors in the country for improved health emergency management. Next slide, please. Finally, to support Guatemala in service provision, Propel is currently working with the Ministry of Health on a comprehensive model of care and management based on primary health care with effective coordination of community, of outpatient, and hospital health network. For entry points and cross-border health, Propel Health, next year will strengthen the capacity of the National Strategy Intelligence Secretariat to develop and apply models for anticipating, recognizing, and address health and environmental security events, as I mentioned before. Propel Health looks forward to continue all the work we just shared with you in the next year. And now, hand it over to Lysium to talk about our work in Honduras.
So good morning, everyone. Dr. Licien Valladares, Country Director for PROPEL Health, DataFi, and EPIC in Honduras. Next slide, please. As my colleagues mentioned before, our situations are similar but not the same. So a little bit of a context. We have a relatively political stability, no elections in the short term, just next year. We have been facing frequent turnover in staff. And as we all know, in the region, there is a weak digital health environment and data availability for decision making. In the country, we have not been able to carry out JE or VE, and it's most likely to be requested by the government in 2025. What I would really like to discuss about is how we have built a strong relationship and collaboration not only with the government institutions, but also with other agencies implementing health interventions in the country, aiming to improve health strengthening and global health security, and implementing a One Health approach. So our partners for this approach are the Ministry of Health, of course, and the Ministry of Agriculture and Livestock, the Ministry of Environment, and ARSA, which is the regulatory office for health, and COPECO, which is the equivalent to the public health emergency operations centers. We work very closely with the ICF and SENASA, which is the regulatory food and safety authority. And we have built a strong coordination with PAHO, with the CDC and the FAO ECTAD program and the UN environmental program. And as Dr. Flores mentioned, we also work with OIRSA, which is the regulatory regional institution. Next slide, please. This is what is our activities are based. Our components are three main. It's a three-pronged strategy. And I would go to the first one that is related to creating a One Health in every environment. And this is basically building a strong governance for GHS under a One Health approach and to enable the establishment of a One Health multi-sectoral coordination mechanism. But more than that is to create and to align all stakeholders in an integrated approach. And surveillance, as Kevin mentioned before, surveillance has a strong component in terms of creating a standard operating procedures, supporting laboratory capacity, all based in IHR, International Health Regulation Guidelines, to respond, to prepare, and to detect and provide a strong surveillance for infectious diseases, not only at points of entry, but overall, but for overall emerging and re-emerging health threats. But what is at the center of all what we do is the strengthening workforce capacity, or as we call it, capacity building or strengthening activities, not only to build skills for data use and analysis, for surveillance, for governance, but to create the capacities that the country needs to respond to health emergencies. So for this, and next slide, please, I'm going to talk a little bit more about the results. And to create a One Health environment, what we decided that was most important at the beginning of the process, we have built a very strong relationship from our COVID work, from our projects with HP+, DataFi, and now with PROPEL. But we needed to know exactly what was the enablers, the barriers that were in the country for implementing a global health security strategy based on a One Health approach. So we learned a lot about this, and we learned that some of the barriers were related not to the will to implement, because it's not a new approach, but they were more related to the capacity to communicate and to coordinate and to avoid the siloed approach that had been enabled before. So for that, we have this, we created a roadmap, and this roadmap created the stepping stones to have an integrated approach that included the national, subnational, and local level for all activities related to surveillance, capacity strengthening, and governance. And in that area, we were very successful to establish and to fully operate a multi-sectoral One Health country coordination mechanism. This country coordination mechanism operates at the national level with the representatives at the higher level from the ministries and also COPECO and other government agencies, but has technical working groups for AMR, surveillance, human resources, IHR, and environment, which is very important for surveillance. And we have been able to map all global health security funding and key actors. This is important, and this comes from our work from COVID-19 that we facilitated a strategic advisory group that was led by USAID, and that allowed the country to align resources and to have an integrated approach for COVID-19 response. So we have transitioned that a strategic advisory group to a global health security advisory group. Next slide, please. As workforce capacity strengthening. From the PAA results, we understood that there was no common understanding of what was One Health. Everyone talked about One Health, but nobody knew how to implement it in an integrated way. So we co-created with the government and agencies and with the support from the CDC and PAHO, a One Health orientation. This is an activity that convey all actors. Over 60 people attended and participated in a process that included over a month in preparation and the implementation in 3 days to go over key topics and what were the barriers and understanding, and to provide a space for network and collaborative working for all ministries and agencies implementing One Health activities. So we held that orientation at the national level. For next year, we're going to have this same approach to the subnational level. So we did also a global health security baseline assessment, and we had 4 key areas to assess, and were zoonotic diseases, AMR, national laboratory system, but for all the sectors included, and human resources. And we have seen at the PA all the problems about communication, having the standard operating procedures, and we have created a capacity strengthening plan. And we have provided also recommendations to strengthen One Health and performance capabilities. We have also been able to provide technical and financial support to complete the epidemiological country profile. So this will allow the country to assess and to see the threshold for emergent and re-emergent diseases and provide rapid actions. And this is all based, and when I go to the surveillance results, we're going to talk a little bit more about the 717 and the implementation in the country as an integrated strategy for outbreak response. So we have created also One Health certificate program for outbreak response with an emphasis on multi-sectoral coordination and preparedness response. We piloted this for dengue, and I'll go over with the surveillance results as well. And we have strengthened laboratory staff capacities for zoonotic diseases, detection, diagnostic, and identification. We have trained over 100 staff at the lab and at the laboratory level, and created the standard operating procedures. Over to the next slide and the results. And this is something that we're very proud of. And these are surveillance results and how we have been implementing activities and doing proof of concept, and creating a community of practice around global health security under One Health approach. So with the surveillance unit at the Ministry of Health and at the Environment and Livestock and Agriculture ministries, we have provided technical and support for completion of the epidemiological profile, and also for the implementation of the national health situation analysis. And this is part of our work that we've done through our DataFi project, implementing national situation rooms and regional situation rooms for data use and analysis. And this is the implementing action for the 717 and deploying rapid response teams. We have also been able to assess 100% of the points of entry in the country, and we have used traffic light methodology that has allowed for rapidly identification of areas for improvement. And this is a work that we have done in collaboration with PAHO and other strategic partners. We have also been able to implement the data use and adapt the data use strategy for global health security. in situation rooms. We have had at this point, I think it's over. When we prepared this presentation, it was over, I think it is over 60 meetings at the regional level for dengue outbreak management. We have, the country has incorporated monkeypox as well, and drill worm activities within the situation rooms. We have been able to carry it out, the field investigation outbreak in Puerto Cortes, which was one of the most affected areas for dengue this year. So we assessed 10 neighborhoods at the Medina sector in Cortes, and we were covering over 1,000 households with 3,572 inhabitants. So we identify, and I think we have been the only one country in the region that has identified laboratorily the dengue variant 3 as the circulating in the country. And for this, rapid response teams were deployed, but also we have integrated rapid response teams that incorporated other sectors and laboratory capacity and community outreach. We have been able also, and this is the first one that has been done in over 5 years, simulation exercise for avian flu, and this was a multi-sectoral exercise that conveyed all actors from the government, civil sector, and cooperation. So we have very important lessons that have been learned. We are at this point doing the after action review, and our next activity within the next 2 months will be to carry out the avian flu drill. So prevention, control, and response, we have created standard operating procedures for avian flu, brucellosis, and TB. And we have strengthened capacity for a sample and transportation and the quality improvement manuals in coordination with the INDRE and BAHO and other stakeholders. Next slide, and I think it's my last one. And just to see a little bit in numbers, we have trained over 376 individuals, over 40 situation rooms, and one multi-sectoral coordination mechanism that is implementing all the surveillance activities. So thank you so much for your attention, and over to you, Kevin.
Great. Thank you so much, Lysium. And, you know, one of the things I've had the fortune of learning over the course of my career is that leadership matters greatly. And, you know, Palladium is very fortunate to have 3 exceptional leaders in the 3 country leads who you have just met, Reynaldo, Germania, and Lysium. You know, one of the things that I think they've done exceptionally well is to think about global health security as an overall area that needs to be addressed, and bringing together 3 different projects, including PROPEL, DataFi, and EPIC, to work together towards solving the problems that exist within a country that will make the greatest difference towards achieving the goals. Next, we're going to turn to our panel discussion. And I would like to introduce our 3 esteemed panelists, who are Jennifer Paraguay. She is the Senior Research Manager at Traverse Science. Sarah Rivera, who is a program management specialist in global health security at USAID. And Edgar Bailey, who's the Regional Advisor for Zoonotic Diseases at CDC. So the 3 of you, we can make sure that we've got your cameras on and ready. And then I think we can move on to the panel discussion. Just for the sake of everyone else who's joined us, once we have a few questions that I'll pose to the panel, and then once we've gotten through that, we will turn it to all of you for any questions that you may wish to ask as well. So let me turn to question number 1. So we know that for global health security to work, human, animal, and environmental health leaders need to work closely together at national and subnational levels. Unfortunately, that doesn't always happen the way that it should. Based on your experiences so far, what are some approaches that really work to bring them together? Have you seen Propel Health use those approaches, for example? What are some barriers to collaboration that we will need to work through? And similarly, if you could speak a little bit to the importance of multi-project coordination and where you've seen that be successful, I would appreciate that as well. So that's the question, and who would like to kick us off? Jen, maybe I'll turn to you. Yep, go right ahead.
Sure, yeah. I'd like to start by just talking a little bit about our experience in El Salvador. I think we have had a few different strategies that have been effective for creating a cohesive One Health team across the human, animal, and environmental health sectors. First is that I think PROPEL Health, in coordination with, of course, CDC, USAID, have provided a number of different opportunities for technical staff from the Ministries of Health, Agriculture and Environment, and Defense to work together towards a common goal. So I think that's a critical element, is not just kind of attending meetings together, but actually working together. Because that creates a shared feeling of purpose and builds mutual trust across sectors that, you know, maybe haven't always worked very well together or don't have a lot of experience working together. So for example, in El Salvador, we have monthly meetings of the National One Health Multisectoral Country Coordination Mechanism, where we break out into technical working groups to work on different components of the National One Health strategy. And again, just kind of like getting in there, working side by side, I think is really important. And then another example of that is the One Health Zoonotic Disease Prioritization Workshop that CDC organized, which ended with a list of nationally prioritized zoonotic diseases. And that was a really interesting multi-sectoral process and engagement where you saw kind of how across the sectors they were sort of teaching one another, learning their respective jargon, you know, their technical terms, and learning more about like the different considerations that you might have if you're looking at infectious diseases from an environmental health perspective versus a human health perspective. And clearly all of these kinds of efforts require a high degree of coordination across the key actors. And in El Salvador, and I'm sure in the other countries participating here, that's where PROPEL Health has really played a crucial role, is in that coordination and enhanced governance. And then I would also like to mention that I think it's really important that there's equal participation and leadership opportunities across the sector so that it's not being dominated by any one sector, right? And then just briefly, I'll touch on a couple of the challenges that we've experienced. I think like others have mentioned, there's a high turnover, both, you know, at leadership levels and at technical working levels. And so that can make it difficult to kind of get your momentum sometimes. And I think not having pre-existing formal mechanisms has also been a challenge. That's something we've been working on in El Salvador, is formalizing these relationships so that they're sustainable and not just based on the goodwill of the existing appointees, right? And then finally, I would say, like, obviously resourcing decisions are really tricky when you're engaging in the One Health space, of just deciding what will be funded by which ministry, by which division, and at what levels. I think those are always kind of difficult conversations to have. Thank you.
Okay, great, Jen. Appreciate that. Edgar.
Thank you very much. Good morning, everybody. So as Jennifer was mentioned, CDC has supported the development of the One Health multi-disease prioritization process in the region. By now, Honduras, El Salvador, Panama, Costa Rica, Belize have already done the process. Next week, we're doing this process here in Guatemala. And as Jennifer was mentioned, there is no sector that is leading the conversation. They are working equally and gathering all the key actors of the three sectors to collaborate and how to coordinate next steps from prioritized list of diseases, and how to respond, coordinate, and integrate activities with the One Health approach. Also, I know that by now, Costa Rica, Guatemala, and El Salvador are working very, very hard to try to legally establish the One Health community in their countries. So let's see what we will see in the future about this legal means establishment, because this is guarantee a compromise to keep working with the One Health approach in the countries. In the region, just Belize has already established a One Health committee legally conformed by the three sectors. So we are very, very interested in what will happen next. Over.
Great. Thanks so much, Edgar. Sarah, let's turn to you.
Thank you, Kevin. Yeah, so I'd like to share some insights from Honduras as well, which really closely align with what Jennifer and Edgar were mentioning. So the concept of One Health it's not new, but we do recognize that it is a new way of working here in Honduras, right? And I think it's likely in most countries in the region as well. So different sectors, like human health, animal health, environmental health, have been working in a siloed way when addressing global health security issues. And this finally prevents comprehensive and coordinated response to global health threats. So I just want to briefly point out 4 concrete examples of Honduras, and I hope it just makes sense that how one thing leads to another and how it has laid the foundation in this initial year that we have been implementing these initiatives in global health security in Honduras. So one of them, Dr. Alicia talked about it briefly in her presentation. So it's just lessons learned from the COVID-19 pandemic. So during the COVID-19 pandemic, lots of donor stakeholders were trying to support the country, and they were equipment, vaccines. It was, we can say, maybe a little bit not coordinated, right? So USAID led and conformed, we can say, a COVID-19 strategic advisory group. And this was, as I mentioned, led by USAID with the support of Health Policy Plus Project and Datafy in that moment. So what this group did is that it brought together all the supporting partners that were in the country at that moment. So building on that example, a similar approach is now being applied to global health security in the country, as we can maybe say as a transition process. So it's important to highlight that in Honduras, that there are very few actors working on global health security at the moment. The initiatives are led by USAID through Palladium, through the projects PROPEL and EPIC, and also FAO-ECTAD has some initiatives here in Honduras. So that is example number 1. The second example, briefly, is just to effectively introduce and implement the One Health approach here in Honduras. One of the first steps, and Dr. Alicia mentioned this, was to conduct a political economy analysis, or PEA. So this allowed us to better understand what were the factors influencing global health security under the One Health framework here in Honduras specifically. So it's an evaluation that, while some challenges might be similar across all countries, we understand that there are things that are specific to countries. So this was applied here in Honduras to understand what was the situation. So one of the most critical findings of the PEA was the lack of a unified comprehension of the One Health concept and what it truly means to work in a collaborative way towards a shared goal. So that is example number 2, right, the PEA. So in response and after the findings of the PEA, PROPEL organized a One Health orientation. It was facilitated here in the country, and it brought together key sectors, animal, human, environment, plant sectors, and it was a way of fostering collaboration and aligning all those efforts to strengthen the One Health approach here in Honduras. And one important thing is that while PROPEL led this initiative, this One Health orientation, We had participation from other key actors that are working, have other initiatives. For example, PAHO in country office supported this, FAO-ECDAD, the United Nations Environment Program, and also the US CDC. So that is my third example. And just briefly, my fourth example is just a way of fostering and enabling environment for global health security here in Honduras. So PROPEL Health, also mentioned in other countries, facilitated the establishment of the One Health multisectoral country coordination mechanism. So this mechanism integrates key ministries. So Ministry of Health is there, Ministry of Livestock and Agriculture, the Ministry of Environment, also COPECO that Dr. Alicia mentioned earlier, which in Honduras is an institution that is just one of the first responders in any emergency situation here in Honduras. And also the regulatory agency, ARSA, for example. So this mechanism or this collaboration, this platform is crucial for effective governance to align resources and strategies to address global health security issues in general, antimicrobial resistance, and international health regulation compliance. So this mechanism also meets monthly, that Jennifer mentioned in Salvador, and it has already developed in terms of reference, their guiding principles, their governance structure, and it has also established working groups to finally ensure a coordinated action and response. So in summary, what I want to say is that the adoption of the COVID-19 Advisory Committee now for Global Health, the PEA, the One Health orientation, and the establishment of the One Health multisectoral country coordination mechanism all have played a crucial role in fostering that collaboration across sectors here in Honduras. And these initiatives have also laid a foundation for a more integrated approach. And it comes just in the right moment because it was the initial year of the initiatives of global health security here in Honduras. So it has laid a great foundation for what is to come next. Thank you.
That's great. Thanks so much, Sarah. And I think you kicked it off well by saying that one of the, that One Health is not necessarily new, but it's challenging to implement because, and frankly, I think probably almost everyone here has struggled with making one something a reality, because we've all had the opportunity to work in situations where it's just challenging to overcome silos. But the notion of having a clear purpose a clear and common purpose that everyone can focus on, and to have enough humility to realize that none of us can do it on our own and we have to come together to really achieve the important goal that's out there, I think helps to step us in the right direction. And the examples all three of you gave were great for that. Another example of a purposeful engagement is around data. So I'd like to ask, data need to come from the right sources. They need to be visualized, and we need both human and animal health information together. And ideally, the data need to be reviewed by human and animal health leaders together. What do you see as the biggest challenges in the cascade of data all the way from collection to review and use? And how do you think we can overcome some of those challenges to the panel? Edgar?
Thank you very much. And that's a very, very good question. Since this is a new topic in discussions here in the countries, also in the region, how we can coordinate actions from where we can start to coordinate something. Data collection and challenges comes from, we can start discussing from a very bureaucratic place, having vertical information and coordination within a sector. For example, if we detect a disease in the animal health sector, how we collate this information to the technical level, director level, political level, to share the information with other sectors, and also the cascade down to from the political to the directors and the technicians in the field to try to coordinate something. Also, that comes with data fragmentation, that there are different databases in the animal health sector and the public health sector, also in the environment, different databases. Also, data privacy and security could be a challenge. So, for example, to try to create a solution, sectors and all the people involved in this response should be try to first to streamline the bureaucratic processes in the countries, also to develop integrated data systems and to create something in as a team, as a One Health team, to try to respond in the better way and to share information with specific key actors and the specific needs of trying to develop a correct response. I think that could be the very first steps to try to coordinate data sharing with a One Health approach. Over.
Great, thank you. Yep, Sarah, go ahead.
Thank you, Kevin. Thank you, Edgar. I think that just building on what Edgar just mentioned, one of the major challenges here in Honduras is the willingness to share information. So sectors gather information, they collect information, they analyze the information, but they have been working in a siloed way. So if information remains siloed, this really limits our ability to address health issues in a, we can call, holistic manner, right? I think that the other very important thing is that reliability of data itself. So for decision making to be effective, really, we need high quality, we need accurate, and we need timely data. So data that is of poor quality or inconsistent can lead to misinformed decisions finally, right? And that affects our capability as a country to respond to health threats. So this leads me to the other challenges, which is technical capacity. So sectors here in Honduras, some sectors lack the expertise needed to accurately interpret data, especially when it comes to integrating human health data and animal health data. That is one of the huge, major challenges here in Honduras. So I think that strengthening skills of professionals across all sectors is essential to ensure that data is just not only collected, but it is also correctly analyzed and finally utilized. So I think that one approach would be to generate a culture of data use and analysis. So just strengthening the capacity of professionals in all sectors to analyze this information, but also to analyze it collectively in a collaborative manner, right? So I just want to give a brief example after saying those challenges here in Honduras, is that in Honduras, there are 5 key areas that USAID has prioritized for global health security. And 3 of these areas are surveillance, health resources, workforce development, and zoonotic diseases. So in Honduras, we have been trying to build synergy across successful surveillance initiatives that have worked in the past, just basically supporting data management. So one of example that Dr. Elysium also touched on her slides is the data use strategy and the activation of the situational rooms. So these are spaces mostly led by human health sector, but also depending on the topic that is going to be discussed, they involve other sectors, animal sectors, environment. And what is important about these situation rooms is that they are at the national level, but they are also at subnational level. So the information can be analyzed where very closely to where it has been gathered, which is the primary healthcare. And one of the most important things here in the country about these situation rooms, and that PROPEL has promoted the meetings of the situational rooms, is that they promote the activation of the rapid response teams, which are at the community level. So it's a link between primary healthcare, rapid response teams where they are, where data is collected, and finally it feeds into a national, like a broader surveillance system. So yeah, I just want to mention that these situation rooms were created during COVID-19, right, to analyze, but now the country has been analyzing, or these situation rooms have been supporting the interpretation of data that is not only for COVID-19, now for dengue, other health emergencies. So that capacity to adapt to any infectious diseases scenario is something that we want. And when it's done with all sectors included, that is excellent. That's beautiful, right? So I would just want to mention that PROPEL has been supporting capacity building in analysis or interpretation of data, and it has also supported the training of COPECO, which I mentioned that, for example, it's one of the, they aren't really like healthcare personnel, but they come in like first responders in any emergency situation. So they have been trained in data use. So they have been involved or been invited to the situation room. So it adds up, just trying to involve the sectors and just working collaboratively. Another example for data use is the examples of the outbreak investigations. So this was something that was done just recently in Honduras because we have a dengue outbreak right now. So it was done in the northern region of the country and Cortes in some neighborhoods. And what it's important to mention here is that situation rooms helped analyze data, but also in this outbreak investigations, community actors were there as well to just inform, interpret data, just to participate in the outbreak investigation. So this finally, what it does is that it strengthens the outbreak response efforts. So out of this outbreak investigation, there are a lot of lessons learned that will just feed into action plans and just opportunities to improve the outbreak response that a strong outbreak response that we're trying to build in Honduras. Thank you.
Great, thanks. Just to orient everyone, I'm going to do one more question to our panel and just take one response because we're a little bit low on time. So on this one, I'm going to pose it to Jen, since we heard from Edgar and Sarah on the last question. Meanwhile, to the rest of people in the audience, please feel free to start typing in any additional questions that you have in the chat. And then after we take this answer, we'll be happy to turn to some of those. And you'll note that some questions have already been asked and answered there as well. So for this question, I'd like to ask, what opportunities do you see to integrate or connect some of the GHS approaches with either vertical programs or with primary healthcare? Sarah actually referred a little bit to some of this in her previous answer. And let me tell you specifically what I mean, because I think this could be a little bit vague otherwise. What I'm thinking is that tuberculosis, for example, requires respiratory disease surveillance, infection prevention and control, and has issues with antimicrobial resistance, including massive fluoroquinolone resistance if fluoroquinolones are used improperly. What are some thoughts about it? So that's one opportunity for intersection. Malaria is both a febrile illness that, febrile illness surveillance could be relevant, and a vector-borne disease, which could be relevant for other aspects of control. And finally, Allison mentioned at the very top of this discussion that strengthening primary healthcare is a critical aim of what USAID intends to do. And I think we can recognize that the next pandemic threat is likely to pass through a primary healthcare facility or community first. And what happens next depends on how well prepared we are at that level. So I realize, Jen, that that's a big question, and you can take a piece of it if you want, but any sense about how we can think about what we're doing here, not in a silo, but in the context of some of the other things that we're doing? Over to you.
Thanks, Kevin. You're leaving me with a nice, easy one.
That's what I'm here
for. It's, we talk about like what opportunities do we see to integrate these? I think this is necessary. I mean, we're all working in resource limited settings. And so we need to look for every possible opportunity for efficiency. So I think one example that they're working on in El Salvador is expanding the existing influenza sentinel syndromic surveillance to include COVID and other respiratory illnesses and expand the geographic coverage of that surveillance network. One thing I'm really excited about, and I think we're seeing kind of a movement right now of it, more engagement with community health workers, and including professionalization, providing specific training for them. And in El Salvador, as Dr. Flores mentioned, this idea of the epidemiologic shield, and really trying to focus on innovative ways to enhance surveillance, and looking to community-based surveillance as one opportunity that we have. So they're working on training health promoters, forest rangers, and the agricultural extension workers to form this national network of community-based reporting for early detection and notification of potential outbreaks. So I think that's one kind of exciting area to look at, is just how we can tap into those more community-based healthcare workers. And that also has the added benefit of enhancing the community engagement and involvement in, infectious disease and global health security issues. And I think this is a really great opportunity to also engage in enhanced education and risk communication with the community. Particularly, I'm thinking about AMR, for example, where you have those engagements in the community for primary healthcare visits, and those can serve as real, good entry points to have some of those discussions and start that very slow process of behavior change, which I know in a lot of regions, including Latin America, there is a real challenge around this expectation of getting antibiotics prescribed when you visit your healthcare provider. So I think also using those opportunities to improve our risk communication and community engagement is another kind of low-hanging fruit that is there for all of us. Thank you.
Great. Thanks, Jen. Okay, so now we're going to turn to audience questions. Many of the audience questions have been have been answered. But there's one here earlier from Raz who asks, who says, thank you for an important presentation. I wonder if you can provide some insights into the cross-border priorities and approach across countries. What can other regions learn from your experience? And this question, we can take answers from members of the panel or from our Palladium country leads, or Sunita. Anyone who feels that they would like to answer this question, please go ahead and jump in. Cross-border.
Jump in. I think that is, thank you. I think that is very important now, specifically that we have the drillworm emergency within the region, and that is a transboundary disease, and that has a very strong implications in terms of economic activities. So there is a lot of momentum right now, and I think what is important is that we have in place that we know how our borders are structured, how our surveillance, the international health offices are equipped within the points of entry, how we have processes, standard operating procedures for transportation of goods. We have that. We have, not we in terms of PROPEL Health or the projects, but the country has created or developed standard operating procedures. We are supporting. There is also a treaty with the Frontera de la Matillo and Salvador, which is one of the, and Jennifer knows about this, and Dr. Flores. So these activities and these protocols can be assessed. So we are also trying to incorporate lessons learned from activities in Panama. They have had more cases than us. So we are trying to see that and to review also management guidelines, clinical guidelines for addressing drillworm. That is one of the examples that I can come across. So over to anyone who has some more experience.
Thank you. Thank you, Lysium. Anyone else want to respond to that question about cross-border activities and lessons that could be learned from our experiences? If not, then I'd like to turn to, and again, feel free if anyone else has questions. I believe most of the others, or actually all of the others, have been answered in the chat. If anyone has any questions, please feel free to type them into the chat, and I'll be happy to turn to that. But Lysium, you mentioned screwworm, and I just wanted to take an opportunity to ask the panel or any of our country leads if any of you have done any simulation exercises for emerging diseases, whether that might be avian influenza or screwworm, and if so, what did you learn from that experience in terms of the current state of One Health, and what can we do about that? Edgar.
Thank you very much. Last September 2023, in coordination with OIRSA, which was Animal Health, Comisca Public Health, CCAD, Central America Commission for Environment and Development, we developed a regional consult. We gather one technician from each sector, public health, environment, and animal health from 9 countries, Mexico, Central America, Belize, and the Dominican Republic, to develop a regional consult of how they consider they can adapt the One Health approach in the region. Also, which disease they wanted to prioritize, and it was avian influenza. In that same workshop, we developed a surprise simulation about an outbreak of avian influenza in the 3 sectors, with different scripts for each sector. And it was very, very amazing at the beginning, because they were like silos. Because we just dropped the first scenario, and they were like a table with the old public health professionals, another table with the animal health, and another with the environment, and they were trying to discuss how to react to the outbreak and how to respond. And suddenly, one noticed that, for example, day 1 of the public health script was not day number 10, the animal health. So they realized that it was like a whole exercise. And then, oh, so we're doing here a workshop regarding One Health. So this is a simulation, not for avian influenza response, but for the One Health adoption and response for outbreak diseases. So it was amazing when we learned that we still need to try to improve the adoption of the One Health approach in the region, and also how to identify key actors, and how to manage communication between sectors, and how to develop protocols and responses in coordination with the other sectors. It was a very, very interesting situation, and we learned a lot in that workshop. Over.
Great, thanks, Edgar. Lysium, did you have something you wanted to add to this one? You're on mute.
I'm muted when I should not be. One of the things that we learned from the simulation of H5N1, we did it a month and a half ago, it was that everyone was very excited, and we have, you prepare the cartillas, you prepare everything, you bring all your documents, and then everyone starts working together, and at some point everyone drifts apart, because the protocols, the standard operating procedures are not meant to be working in coordination. And one of the things that was most important is how environment has not taken the opportunity, or to take the place that it should be. If we're going to talk about zoonotic spillover and some other things, that is an area that is the expertise or the authority of environment for wildlife. It's not agriculture and livestock. So those interactions and how to communicate. And one of the things that we learned, it was super important, was about the community engagement and how to communicate, as Edgar said. Communication is communication, and at the end, everything is about people and the way in which we coordinate and engage. So there are just too many lessons learned, but the final one that they did ask is that whenever we do anything, that we need to share results and do after action reviews, and keep a cycle of capacity improvement, quality improvement, just to keep everything flowing and to keep everyone involved. That is the most important thing. People need to feel identified and that there is something that is for them, for everyone to gain in the process. Thank you.
Thanks, Lizzie. And thanks to everyone who contributed to that. We are now at the end, near the end of our time. So let me just say, offer a big vote of thanks to our three panelists, Sarah, Jen, and Edgar. Thank you for spending this time with us and answering questions today. To our country leads, Rinaldo, Ermenia, and Lysium, thank you for presenting, but thank you also for being the types of leaders who lead by example in finding ways to break out of silos to solve a problem that is distinctly not siloed. We really appreciate your leadership and your effort in everything that you've been doing. I'm grateful to Alice Chang, who joined us today from USAID. It was great to have her offer her insights from the USAID standpoint, and to Sunita for for all of the work as the PROPEL Health Director as well. And finally, there's many other people who were involved in establishing this, and we really appreciate all of the work that went behind the scenes to do this. And finally, to Vina for all of the facilitation and for making this happen. It's important, and we couldn't have done it without you. One last thing I'll add to those of you who have been watching this webinar, if any of you saw anything where you think that you have an idea for us, you think that there's something that was especially good, or frankly, something that we might be missing, please let us know. Send us that feedback. Our goal is to maximize our impact and to do our work as effectively as we possibly can in support of the governments that we're working with. We can do that best if we get feedback and hear about things, both good and bad, that might help us to improve. So please feel free to offer your suggestions anytime. We would very much appreciate that and know that you have a lot of experience out there. So with that, again, thank you all for joining us, and have a great rest of the day and week.